Welcome to Bits and Bytes. Today we're going to talk about innovations, technology and healthcare. We have on the sets Afeef Ahmed talking to Arjun Bala, who is an IIT Bombay alumni, a patent attorney, a founder of Metayage IP Strategy, which is an intellectual property firm, and Goldsmith software. I wonder what that is. We need to find out more.
Welcome to another episode of Bits and Bytes, and today we're going to talk on innovation in the healthcare segment, right? And I have with me an ex-IIT alumnus from Mumbai, IIT Mumbai alumnus, Arjun Bala. You run your own IP strategy company, Metayage. You also run a startup called Goldsmith, right? And you also work with a lot of companies in the startup segment and companies that do a lot of innovation in helping them structure their entire IP strategies, right? So great to have you on board. Thank you for accepting the invite.
Thanks, Afeef. Pleasure to be here.
Great. So before I get started, Arjun, right, there's a lot of buzz around patent and IP and things like that, and a lot of people who share a lot of versions, right? Now, as someone who's in the industry, someone who works with innovators and innovation companies and IP, can you just throw some light on IP and patent and a lot of these words we hear?
Sure. So, first of all, intellectual property or IP is an asset. As Robert Kiyosaki says, assets generate wealth. So, it's not just enough to have a regular income. Unless you convert that into assets, you're not really on the track to becoming wealthy. And you talked about patents, trademarks. These are all forms of intellectual property rights, and each of them is an asset, which is contributing to the wealth of the organization.
Okay. So, and you create a patent for something that's new, something that's out in the market, right? So, is innovation really happening in India? There's a lot of buzz around it again. So, is innovation really happening here?
Yeah. So, of course, innovation is happening all over India, and one form of innovation that we see is by multinational technology companies setting up their R&D centers in India, simply because we have so much engineering talent here. But it's not only the multinational companies, but it's even startups and education institutions, even faculty members, students. So all of them also coming up with innovations, and we work with a lot of them.
Okay, so we hear a lot of tech startups and tech-based innovations, right? Coming to our topic for the day, right? Is innovation happening in the healthcare segment?
Yeah. So in healthcare, actually, India is very well poised to innovate. Simply because of the engineering talent that I mentioned, and also there's a huge local market. There's a huge problem here, right? In the Indian market, the cost of healthcare is rising, so it's a huge challenge. So I see it as an opportunity being an entrepreneur.
So so one area is where we see a lot of cost and a lot of expenses in the healthcare segment, and you're also saying that we have a lot of innovations happening in the healthcare segment, right? So how are Indian companies innovating to handle this? Inflow of MNC-based products and IPs coming from non-Indian companies, right? So how are Indian healthcare innovators able to handle that?
Sure. So when you talk about innovation, it's always been ahead of the curve. So the way to do that is through disruptive innovation.
Okay. Can you just share an example? I know you work with a lot of firms, and I was pleasantly surprised to know that you've also been able to create certain patents for some of these firms as well, right? So, can you share an example as to how an Indian innovator or an Indian firm has created this disruption?
Right. So you talked about the cost of medical equipment and all these big companies coming in, right? So I know about a startup company which is in the space of ECG monitoring, which has come up with a disruptive innovation. Okay. So currently, if you want to do tests. If you have to check whether you have a heart problem, right? You spoke about the rising cost of healthcare, and it's partially because of a lot of the medical equipment having to be imported from countries such as the US, which makes it quite expensive for the Indian population, right? The exporters with this medical equipment being sold in India, how are these startup companies that you work with? How are they competing with these multinational players?
Okay, great. So when you look at healthcare again, and if you look at the rising expenses, right, there's a lot of import of non-Indian medical equipment that happens here. That's increasing the overall cost of expenses here, right? So how do Indian companies in the healthcare segment tackle that piece right now? Where is innovation happening and how are you going to handle that?
Yeah, so it's obviously a regular small incremental innovation is not going to be enough for them to really tackle this threat, right, due to competition.
Right.
So they have to disrupt, they have to do something significantly innovative, and that's what makes a big difference.
Okay, and I know you work with a lot of organizations, right? So can you share one example of a firm which has created this disruption in the market?
Right. So let's take a simple example about like heart ailments, right? Cardiac ailments. Most people die because of cardiac diseases.
Right.
And people need to go through a variety of tests to check their heart's health. And one of it is a simple resting ECG. But there's also more complex tests, like there is something called a holder, where you go on a treadmill and you go to a hospital which has a big piece of equipment.
So what's a holder again?
Yeah, it's this big piece of equipment that you find in like large hospitals, where it's kind of plugged into you do a treadmill, you run on the treadmill, and then it checks your heart rate and all that. There's also something called an event monitor. So there's so many different types of big equipment that people use to monitor the ECG, right? But there is a startup company here in Bangalore, which is founded, which is actually bootstrapped, right? And they have come up with a simple solution, which is taking all these complex analysis that are happening on a Holter machine or on a even including resting ECG as well as the event monitor, and they're doing it on a simple tablet. So basically, they capture the ECG data using electrodes, which is transmitted wirelessly to a tablet, and the tablet does all the algorithms and analytics which is there on all these complex devices. And because of this, it's like very easy to install this equipment even in a small healthcare center. You don't need to go to a big hospital.
So you're saying all that happens on the tablet right now?
Yeah, through this innovation, it's possible.
That's fantastic, right? And we also hear a lot about AI and how AI is influencing a lot of segments, right? Talk to me about AI in the healthcare segment. Have you seen AI happening there, and can you just throw some light there?
Sure. So a lot of data is being captured through the diagnostic equipment. So we have like X-rays, and a lot of the data will coming for diagnostics, right? So one example, one problem which is very widespread is breast cancer, and a lot of women are reluctant to go in for a mammogram because it is invasive, it can be painful, it can be uncomfortable, and it could also be expensive and time consuming. So that's why a lot of breast cancer goes undetected until it's too late. So there is a startup company here in Bangalore once again, which is actually using thermal images, which are like non-invasive, which is not a photograph. It's just a representation of the temperature. Using that as a basis and applying AI algorithms on these thermal images to detect breast cancer early.
That's fantastic, right? So we're seeing real innovation. We're seeing usage of AI. But can I is it a true statement when I say that investors are a little wary when it comes to investing in a healthcare startup or anything to do with a healthcare product?
Yeah, there might be some truth to it, because when it comes to healthcare, right, it's a longer life cycle for a startup to take the product into the market.
Right.
So there are many risks. There's technology risks. There's also regulatory challenges, right? They need approval before they launch a piece of medical equipment or something, which can impact people's lives. So that normally takes time. But say there are examples of investors who are willing to invest in healthcare startups quite early on, even here in India.
Okay. So what would drive an investor to invest in a healthcare startup? I mean, we know the risks, we know the turnaround time, right? So as an investor, what would drive you to put money into a healthcare startup, or someone who's looking at coming something with a novel innovation in the healthcare?
Sure. So of course, I'm not an investor myself, but from what I understand, right, one thing that investors always look for is having a great team. Like that's common to any startup. But in addition to that, right, there should be a huge market. And when you talk about breast cancer, that's also a huge market, right? But finally, the area that I'm qualified to speak about is IP. Like I said, IP is an asset. The value of a company is largely dependent on the IP assets that it owns. And if a healthcare startup company can build a solid portfolio of IP, then the investors know that this is a company which is valuable, and there is a huge market which this company can capitalize on the basis of their IP assets.
Right. So it's great that technology is enabling a lot of innovations to happen, and we see a lot of changes in the healthcare segment again, right? But if question again, Arjun, is do these innovations in the healthcare segment impact lives?
Very good question, Afeef. So let's go back to the same example that I talked about, that you're doing the ECG monitoring on a tablet.
Okay.
So that solution, right? So if you didn't have that, typically a patient, if they had to go through a variety of tests,
Right.
they would have to probably go to this large hospital, which can afford all this expensive equipment like a Holter, right? And they would have to maybe spend quite a bit of time in the hospital, and they would get charged for a lot of additional things. Just to get the test done, they would get charged for many additional things, right? It becomes very expensive.
Right.
But whereas if this tablet and the system is just available in a small healthcare center, or someone can go and get all these tests done, he doesn't need to get admitted or involved in the hospital and the other functions.
Right.
And basically here, one disruptive innovation, the way I see it is, they're just getting charged for the reports.
Right.
They don't have to pay for the machine, they don't have to pay for the hospital.
So what you're saying is it's not just innovation of through technology, but what we're also saying is that the business model has also got innovated in the process.
Absolutely.
Right? So it's changing the way,
Yeah.
right? So someone doesn't have to go through the entire system of having to go through multiple machines, but just goes through one place. So which means you've knocked off a lot of other things in between. Right? So we're seeing a significant change from your example that the business model itself has gone through a series of innovation again. Right? And so that might excite investors. What happens when someone doesn't get investment? Right? For instance, and I'm sure there are certain organizations, certain individuals that can maybe bootstrap themselves and get some initial funding from whatever savings or capital that they can arrange from. Right? What about the other organizations which do not have funds and understanding the incubation period that a typical healthcare startup or a product might take? Right? Where do these guys with brilliant ideas and possible disruptions actually go?
Right, so this ties into the question that we talked about. Since the risks are high, typically like venture capitalists might not be so keen to invest early stage in a healthcare technology startup, right? So, but there's other options, thankfully. There is, for example, there's a grant given by the government called the Biotech Ignition Grant, BIG.
What's it called again?
The Biotech Ignition Grant.
The Biotech Ignition Grant.
Yeah.
Okay, I'm hearing this for the first time.
Right, so if you are an innovator, you have an idea which is relevant for the healthcare space, you can get a grant. It's not like an investment in equity or a loan. You just get a grant of maybe it could be 25 lakh rupees or it could go up to more than that, just to build a prototype.
Right.
So just to test if your idea is working and so on, you get this grant. And say if you cross that, you reach the stage where you have the prototype and you can demonstrate there's something that's working and you've created some IP as well, right? So then there are a lot of opportunities you can get incubated. So there are incubators like, for example, there's the NCL Venture Center in Pune, there's CCamp in Bangalore, and there's the IIT Bombay's incubator, SIGN. So these will actually take those early stage startups and they would groom them, they mentor them, they give them access to a lot of other resources and take them to the stage where then they become ready for venture capital investment.
I was not aware of this, and I think that's a fantastic boost, right? So I think you've also sort of created a little awareness in terms of where someone with a great idea and not a lot of funds can actually go, and you can at least bring your idea to a certain level of like you said, prototyping, for example, right? And are companies using this? Are they aware? Do you find a lot of healthcare companies using these grants?
Yeah, so it may not even be a company, right? A small innovator has got an idea. He can start by applying for the grant, and then he can start a company. So it's basically about having the awareness and also being willing to take that risk and start a startup. And once you take that risk, right, there's a lot of resources that become accessible to you. So it's about
great. I think that's a great takeaway from this little chat that we've had so far. Any final piece of advice or suggestion that you have for innovators in the healthcare sector?
Yeah, in fact I do. So one way of identifying large opportunities for you to do a healthcare startup, right, is to find out what the large companies are doing, because that gives you an indication of the future. And large companies are already investing millions or billions of dollars in trying to create the future.
Right.
So, and how does a startup know where that future lies? So, one answer is that you look at patent data, try and track what large companies are doing in that domain,
Right.
and what problems they are spending a lot of money on trying to solve.
Okay.
And then, if you come up with a better solution to the same problem than the large company and you patent it, then you know there's a huge market opportunity waiting for you.
Great, fantastic. So, a quick word to all the tech or non-tech investors in the, innovators in the healthcare segment. See what the biggies are doing, right? See where the investment, because obviously someone invests a lot of money, they have a sense of the market, they have a sense of direction there, and see how you can create something that can be simplified, looking at what the big ones are doing as well, right? And the key word again is make sure you create an IP for what you're doing, right? You wouldn't want to let your hard work just go down the drain. So that is fantastic. Thank you for sharing, your advice on, because a lot of people want to do a lot of things, might not have the right source, and hopefully, your little chat right now has, helped people to go to a few places and, maybe an open mindset on, how you can take innovation in the healthcare segment, through a slightly different route, right? So, Arjun Bala, thank you once again. It was a pleasure having you on the show.
Thanks, Afeef. Great to be here.
Thank you again.